I'm delighted to join you for this side event to talk about innovations in SDG monitoring in Ghana's 2025 VNR. So what I'll share today is a story about innovation, and it's about how we are trying to make data not just more available, but more actionable, especially at the local level, to support the monitoring of Ghana's SDGs. So what we are covering today is basically first how we automated multi-dimensional poverty report across 261 districts. And here we are basically dealing with SDG 1.2.2. And then we'll follow up with how we are using geospatial tools to zoom into data literally to the 1 kilometer grid. And then finally, but not the least, how we are innovating in SDG 16 monitoring. And here we are looking at new, faster ways to measure governance outcomes like corruption and inclusion. So let's start with poverty. Poverty is not just about income, but we are basically looking at multidimensional poverty, which actually incorporates education, health, and then living standards to give the fuller picture. So using new data science tools box, we generated district-level multidimensional poverty indicators reports for all 261 districts in Ghana under 6 months. And in fact, this was a very innovative approach to executing this in such a very short period. It used to take years to get this type of data. Now, this kind of detailed local data is actually available in time to influence decision making. And here, partnership helped a lot because in 2020, for example, Ghana received capacity support from OPHI to compute multidimensional poverty, and we also received some support from Denmark, Services Denmark, that provided some training with regards to automation. Now, we're able to give the data from regional and district level as well. So the next slide shows intra-district MPI within 1 kilometer grid. So here we pick the districts and then we try to tell the story within the grid framework. So we took it a step further, mapping poverty within districts down to 1 kilometer by 1 kilometer grid. Now we leveraged a geospatial platform and we're able to look at the percentage and number of poor persons for every 1 kilometer by 1 kilometer grid, which is available to ensure that we can do targeted interventions. The graph shows that different parts of local levels experience multidimensional poverty differently. Now, what is the story coming together to tell? Now, the impact of the MPI in particular on one particular district called Efija Wabre North District actually brings out the relevance of such an exercise. So here we are looking at a real world example, and the data showed that low health insurance coverage was a major poverty driver in this particular district. And this because there was no office anywhere in the district for residents to register to renew their insurance registration. The key decision makers in the district were deliberately targeted for the dissemination. So a decision was made the week after to act on the low-hanging fruit, which was to ensure that once we had issues with regards to health insurance, we addressed it. So the district teamed up with the neighbors, they deployed mobile national health insurance registration teams, and then removed financial barriers and travel barriers as well. And what was the result? So here we are looking at more people being enrolled into the program, more protected from health shocks, and also the data turning into actually real impact. So this is just one study that was done, whose results and whose follow-up action resulted into an impact. So we saw statistics actually doing the job. And then I would also like to talk about SDG 16, which is on governance data and how Ghana, and for that matter, Ghana Statistical Service, is addressing this. We know good governance underpins everything else, but it's notoriously very difficult to measure. So we introduced a rapid survey model, what we usually refer to as a CATI, that's a computer-assisted telephone interview. This is fast, it is low cost, and built entirely on Ghana's own statistical capacity. And for this exercise, we fielded some field workers to work within 3 weeks to get us data from January 2nd to 20th this year, with a reference period of January to December 2024. And we used phone numbers from the national census and reached over 7,000 adults across all the regions. And the subject matter we're interested in was on bribery, inclusiveness, responsiveness, and election participation. And we executed this in a way that it was representative, it was legitimate, and it was fast enough to give us information to support timely decision making. Now, some of the results from the survey, as we can see on the screen, found about 57% of Ghanaians accessed public services in 2024 from the survey or from the exercise. And those who reported paying bribes are about 18.4%. And we see that it's even higher for persons with disability, which is about 21.1%. And nearly 1 out of 10 persons were asked to pay bribes by public officials. And this is not abstract, but it's actually a daily reality about trust in the state. And this gives leaders a real-time incentive to act because we can measure change over time. Now here, what we were doing was to measure inclusiveness of decision-making. So we ask about voice. Do citizens feel included in decision-making process? And this actually relates to SDG 16.7.2, ensuring inclusive participatory institutions. And as we can see, the results show that about 42.4% of respondents were not at all included in the decision-making process, but there were marked regional differences. So when people, as we know, if people feel very excluded, it erodes legitimacy. And so these numbers become very important for decision makers to be guided by what is happening on the ground. So with all of these, what are the learning and outcomes from this particular exercise? What did we learn? First, we go from design to final report in just 3 months. Unlike usual surveys that will take a number of months to execute and to produce reports, within 3 months, we have very quick results and there's a quick turnaround. So second, the entire process cost very little. In fact, the cost estimate was about 15% of a usual survey. So it means that not only are we getting the results on time, but it's also less costly. And third, we didn't need external consultants to execute this. We built this in-house, and now we can repeat it over time. It provides an opportunity to collect panel data to track progress over time as well. And this data gave political leaders a pulse check on public perceptions. We just released it 2 months ago, right? Yeah, in Ghana, 1.5 months ago, I think. And I think the reaction we got from our political bosses was very good, because then we brought the information to their notice. And it was a talk about in town for a very long time with regards to what we can do to address some of the outcomes from the survey. I must say that because of this and many others, the government was able to include the Ghana Statistical Service in our next round of anti-corruption plan that is currently being updated. So we had a seat at the table. And that's what happens when your data earns trust and when it becomes part of governance itself. So ladies and gentlemen, this was the wave 1 that we did. We've actually currently started the wave 2. We've started the data collection exercise. And this will enable us to be able to track this over time, so that our policymakers would know whether the interventions that are being put in place are actually working or not working. We believe this model will serve others too. And this is an African grown, scalable, low-cost approach to monitor governance under SDG 16. Thank you very much.